Hello, everybody, and a very good evening to everyone out there. So, I'm your host, MC Myra DeCosta, and welcome back to my channel. So, for today, as promised, we have got part 2, and today we're going to do COVID talks right again with Dr. Shraddha out there. So, this is Dr. Shraddha just for you all, everybody. Introducing her again. She's a professional walking in right from BARC Hospital, that is in Mumbai, and she's been working in the COVID ward for like from 2020 out there. So she has all the experience and knowledge that you require. And so, Dr. Shraddha, tell me, how have you been feeling today? How is the COVID situation out there, and how is everything going on?
Here in Mumbai and Pune, like in Maharashtra, it is getting a bit better. But even actually in the entire country, slowly the numbers are coming down. So this wave is on the down.
Oh, well, that is really positive and really beautifully said. Thank you so much. At least some hope to start this very own part 2 today. Let's not waste any more time. We have, lots of things to do for today. And for today, I have brought forward to you a question. Again, let me present to you the list out here for today. So basically, many of our users have come forward, and there is a couple of questions which I've already sent in to you, and I hope you're ready because this is the first question coming out to you from Ariana D'Souza. Can a person be a suspect of COVID without any symptoms?
Yes. So the thing is, when you get an infection, you take at least 5 to 6 days and maximally up to 14 days to develop the symptoms. And sometimes, during this period, you don't have any symptoms. And after the 14th day, you may have symptoms. So that is why this period is the quarantine period if you have come in contact with someone who is having COVID right now. Apart from that, there is also a thing called asymptomatic patient, which means a patient who has the COVID infection but does not have any of the symptoms. So he or she may have some mild fever, some cough here and there, maybe loss of taste or smell, but they don't have any overt symptoms like high-grade fever, which are very typical of COVID. So in such cases, now we are seeing that there may be lung damage. So it is very important for people who have been exposed to COVID, that is other people who have developed COVID infection, to get themselves tested. So if you have come in contact with someone with COVID, please get tested. And apart from that, since this is a thing that you may be an asymptomatic carrier of the infection, you must maintain social distancing and be very, very vigilant of having COVID.
Okay, and I think that is very important to be doing right now also, because in the recent days we have seen how important it is to just take the simplest precautions out there for us today. But thank you so much, Shraddha, for putting it so well for us. All right, so doctor, you very well explained to us the things that have been, we need to do out as an individual. But here's the next question that is coming in from our next user of Insta, that is Sanjio Francisco Pereira, who has a question. Does steaming help in any way?
There have been multiple studies to see if steaming helps in any way. So what steaming does is that it relieves some of the congestion in your nasal mucosa and your sinuses, but it does not help in avoiding the COVID infection. There has been no proof that it has helped in any of the studies. In fact, there have been some issues where children have come with burns and stuff because of the hot steam. So steaming has not helped. No, steaming does not help.
Steaming does not help. Okay. So I think we need to keep that in mind, because there are many of us, I think Indians have mostly been following the Chinese aspect and how they went ahead and they were keep recommending steaming, something like that. But okay, that's a new thing right out for us. So as you have mentioned to us about it, there are more questions coming in, and the next question comes from Relax, again another Insta user, Insta follower. He says, how does COVID vaccine work in our body, and is there any side effects while taking it or after taking it?
Whenever a foreign object or a foreign virus enters your body, through your nose, through your mouth, any part, even on your skin, your body sets up defense mechanisms to fight against it, because it's not a part of your body, it's something foreign to your body. So your body will try to kill it off or remove it from itself. So this is called the immune system. So whenever a virus enters your body produces what is called antibodies to get rid of that virus. So what vaccines do is they take part of the virus or sometimes dead virus, they inject you with it, and then your body produces the response as if you have been actually infected with the virus. So what happens is your immune system gets ready. Your immune system produces the antibodies that are to be produced when you get a COVID infection. And it remembers, it develops a memory and it remembers that this is something I've had before. So when you actually get the infection, say 2 months later, when you get the infection, your body will remember that I have had this before and this is something that I can deal with. So your body knows what antibodies exactly to produce to kill off that virus. So this is how the vaccine works. Now coming to the side effects, most of the side effects that the vaccines are having are very, very mild. So mainly the AstraZeneca or the Covishield vaccine has pain at the site of injection, fever, then body ache, loose motion, chills, nausea, and rarely, like 0.6 in 1 million doses, there have been like clot formations, thromboembolic event, but it is nothing to be very worried about because the incidence is very, very low. Then Covaxin, a vaccine also has some side effects like cough, cold, and some sweating and dizziness. But all of these symptoms are something that can be dealt with. If you get the chance of getting the vaccine, please go ahead and get it. It works really well. It is our one chance to get out of this horrible loop that we are stuck in.
True, and I believe no matter what the circumstances is out there, if you're getting an opportunity, please go ahead and get yourself vaccinated because, as doctor said, at least build up your immunity to get hold of something that when it hits you or when you're in COVID period, you are safe and you have a little milder effect of the virus. So, doctor, you have very well told us about, taking the vaccine. And also here we have a next question coming in from Clinton Fernandez, who says that if a person takes a vaccine and the next day he is tested positive, would there be any side effects or anything of that sort?
So no. So the thing is, once you get infected with COVID, you take 5 to 6 days up to 14 days to show any symptoms. So say you take the vaccine today and 2 days later you test yourself for some reason and you find out that you are COVID positive. So that will be because you have had the infection 1 week or even 2 weeks earlier. Also, there is no interaction of the vaccine and the virus as such. So there is no adverse effect of taking the vaccine after you've been infected by mistake. But if you are infected, then you should wait for 3 months and only then take the vaccine.
And I think with this view, many people, I hope they go ahead and take the vaccine because I know there's a little bit of crisis at the moment about the vaccine, but I think it's better and safer to admit to the vaccine rather than admitting yourself to COVID.
Absolutely. Yes. That is our only hope to get out of this pandemic.
Okay, so doctor, thank you so much for telling us about the vaccine, the side effects and all. Another question that is coming in from a user named Steven. He has a question saying, is private treatment better or is government treatment better, keeping in mind the attention that is given over time?
So private and government hospitals are two different things. Government hospitals cater to a lot of people. So the number of doctors is less, the number of patients is much more. So it is difficult to manage a patient on a one-to-one basis. While in a private hospital, there are more doctors and less number of patients. So you can get a single room if you want, or slightly better attention. If you call someone, say a mama or a maushi, to help you around, they will come a bit faster. That won't happen in a government hospital because everyone is overburdened with work. So that may happen, but the medication that you will receive, the treatment that you will receive will not differ in a government and private setup. Both the setups will have the same treatment. So it basically depends on you. If you can spend a bit more money, because private hospitals are obviously costlier, so you can opt for a private hospital. But just because you have to go to a government hospital, or you are forced to go there because you didn't find a bed in the private hospital, you should not be worried, because government hospital will also treat you the same way that a private hospital will.
and never ending, actually, you can say, conversation about, whether it's a big debate, like whether it's better or not, expensive and all. But I think each thing has its own pros and cons.
Yeah,
So
absolutely.
whoever likes the way it is, you can go with it. Okay, so doctor, right now you answered about the treatment, but now moving forward, we have another user by name Nestle Narona, and there's also Sean Fernandez who have a similar question in mind that they've put forward to you. So basically, the question is, how many waves does COVID have, and when will it get over?
I know that is the most asked question to any professional right now, but it's a very, very difficult question to be answered. The thing is, there are several experts from IIT, from Indian Statistical Institutes, epidemiologists, virologists, all of us working on this same question. There is this Indian supermodel for COVID-19, which is also working towards the same goal. They're trying to predict the number of waves that we'll have, how we can, prevent them and how we can work towards them. But the truth is, predicting these waves is becoming difficult because of the mutations in the virus. You cannot really predict the behavior of the people around by statistics. So it is very difficult to say how many waves there will be. So the next wave, third wave, is predicted to be around November to December. And it is said that this wave will hit children more than adults. So that is something that is there. But the thing is that once we achieve herd immunity is when around 60 to 90% of the people have developed immunity for a particular infection. So since they have immunity, they won't spread that virus to other people in the community. So when we achieve herd immunity, if it is achieved by getting the infection, there will be a lot of mortality, no doubt. But if it is achieved by vaccination, then it will be how we can get out of this bad cycle of pandemic. So our main goal here will be to continue the vaccinations, get the vaccination whenever possible, and get out of this. Otherwise, this is a moving target. The end of pandemic is a moving target. We can predict that maybe we'll get out of this by end of 21. Later on, we may feel that end of 22. So it's a moving target. So unless and until we complete the vaccination, until then, maintain social distancing, not attend super spreader events like big weddings with a lot of people. We must wear masks, at least 3-layer cotton masks. If you're wearing 2-layer or a single layer, wear 2 cotton masks. If you are wearing a single mask, then wear an N95. So these precautions must be taken. Only then will the next wave be avoided.
Yeah, and I think many of us will agree also that 1 year back, India was like the top nation where there was, super control, lockdown all over India. And just 1 year, everything has changed. We are back on the top, but for the, being
Wrong
with the
reason.
most cases and cases, yes, for the wrong reasons too. So I hope this may be a waking call to all our viewers also watching in over there. So right now, doctor, you have told us very well about all the things that have been happening, what we need to do, and about the waves and stuff. So moving on forward, we have Shrutitya Dargarkar, who has brought a question yet again about what to do when we are facing breathing issue and we do not want to go to the hospital. Then what do we do?
Okay, so I would strongly advise against not going to the hospital if you are having breathing issues. Because the thing is, the fact that you are having breathing issues means that your lungs are involved, which means that your infection is not asymptomatic or mild, which means that it is a proper infection. You must go to the hospital because once it starts progressing, it progresses very fast. So it is important that you go to the hospital. In case, say, you are staying very far and you have COVID, it would be great if you could invest in a SpO2 monitor or an oximeter, which is called. It is available on Amazon. It's 2,500 to 3,000 the cost is, and you can pool in with a few of your neighbors and buy a single one for a lot of you. You can sanitize it and use amongst yourself. But having that oximeter will help in the sense that you can monitor your own SpO2, and if it's dropping below 94%, then you can immediately go to the hospital. Or Apart from that, I think you must go to the hospital if you are having breathing issues. There is no other option.
No, and I think as you said also about it, like neighbors can also, try and if they cannot afford, there are many NGOs also coming. You can get the contacts on Facebook, Instagram, anything. I think that's a very brilliant suggestion also given in. Thank you for that, doctor. Okay, so doctor, you told us so much, but right now there's this new thing about the fungus. And with regards to that, we have Jovito Fernandez asking us the question about the fungus, like the type of the fungal disease that is there for due to COVID, and also the necessary steps that we need to, go according to the process, in order to prevent it, because we have black fungus that has been going on all over India, white fungus in Bihar, and now there is something known as the yellow fungus that has come in recently in the edition. So tell us more about it.
So the thing is, all these fungi have already been there. The spores of these fungi occur in the environment, in the air all the time. But when you have a low immunity, that is when this fungus spreads or beards inside your body. And that is when you get symptoms. So a healthy person without COVID we may not get infected with the fungus, but you have had COVID and you have had steroids given to you, immunomodulators given to you because your body was not reacting well to the infection. And after that, you also have, say, uncontrolled diabetes. So in that case, you will have a higher chance of getting the fungus. But if you are usually a, say, mild COVID patient or like a healthy person without COVID, there is very, very little chance that you can get a fungal infection. Like other common fungal infections, like candida infection, which occurs on skin, where sweaty parts of your skin, or ringworm infection, these infections are common. But mucormycosis, which is black fungus, or aspergillosis, which is white fungus, these disorders or these fungus do not really occur so fast. You need to have really low immunity for them to bear. So the symptoms are very, very varied. If we listen to the symptoms, if we look at the symptoms, you may think that these are symptoms that I have right now, or I may have. For example, aspergillosis has cough, fever, diarrhea, white patches in oral cavity and skin lesions. Mucormycosis, or the black fungus, has nasal blockage, bleeding, discharge from nose, facial pain, and these symptoms, blurring of vision even, or numbness. But like I said, this is not something that you need to be worried about. If your immunity is really low after you've had COVID, then there's a chance that you will get these infections. The treatment for them are varied and available. Some parts of India, they are not available. The reason people are worried about them is that they spread really fast. And if they do, and we are not able to control it with the usual antifungal medication, we have to take some drastic measures. So that is the reason that everyone is worried about this fungi right now. But apart from that, if you're a healthy individual, you really don't need to worry about it.
Yeah, and I think I strongly believe that right now this is just the new stage, so people are still in experimental part of it. But apart from that, I would agree, immunity really plays a very important role, because if you're fit and fine, you can tackle it even better. And very much even not believing about what forwards or rumors that are coming in, and just being frightened from that. So yeah, because recently there's something going on about the vaccine thing, which has proved to be fake. So I hope that message comes across to many of the people who have asked me also on that question. So yes, doctor, thank you so much, because everything what you have told us has been very educational for both the parts, part 1 and part 2. And I'm really glad we could do this entire session right here, in spite of all the trouble that we took. But thank you so much for joining us. A really big thank you on behalf of Goa. We are really grateful to have you speaking to us, and I hope the viewers also have been watching and learning more about it. Doctor, thank you so much. I know you've been busy, but still have given in your precious time. So thank you.
Most welcome. Thank you for having me.
Thank you so much for joining in. Anyway, so this is all for today, folks. Again, if you have liked this entire session that we have had over here, I know it's a bit lengthy, but it is informative and educational. So you need to know what's going on also. And Doctor right there, she did something yesterday, like going for the likes. Okay, so please don't forget to like, share, comment, and also give in all your comments that you have, any difficulty, questions, anything that even maybe personally we can put it forward to you. And in case if you are interested in a part 3, please DM us down and let us know what is your thought on that. Until then, please don't forget to subscribe and hit the bell icon to get more notification coming right from this channel. So thank you everybody. This is your host MC Myra DeCosta, and that's Doctor with us right there. We are saying a big bye-bye to all of you. Thank you so much. Good night and be safe. Bye-bye.